We are surrounded by polymers every day, wherever we go. They are a fundamental part of our lives, and it is hard to think where we would be without them today. For example, take a look around your room at home. Polymers are literally everywhere. They are in our laptops, our stationery, our music players, our drinks bottles. The list goes on. They really are everywhere. So what actually are polymers? Polymers, also known as macromolecules, are defined as large molecules made up of a long chain of covalently bonded smaller molecules called monomers. These monomers are the small repeat units of polymers and can be linked together by the process of polymerization. Polymers made up of repeats of the same type of monomer are known as homopolymers, and those that involve different types of monomers are known as copolymers. Perhaps the simplest example of a polymer is polyethylene. This polymer is made up of a chain of covalently bonded carbon atoms and can be thought of as an extension of the ethane molecule. Polyethylene can have different properties as a polymer, which lead to it having a range of applications, some of which are useful in the human body. Polymers were first discovered by the German chemist Hermann Staudinger. Before the 1920s, molecules are not believed to exist with a molecular weight of more than a couple of thousand. It was Staudinger who proposed that polymers, made up of tens of thousands of covalently bonded atoms, actually existed, and since then on, development of polymers has exploded. One particularly interesting polymer development is that of biomaterials, or biocompatible polymers. Such polymers have had an incredible impact on the medical world, leading to the development of prosthetic limbs, dissolvable stitches, stents, and much, much more. Biomaterials are synthetic or natural materials that interact with biological systems and are able to replace parts of a living system or come in contact with living tissue. Biomaterials are used on a daily basis in surgery, dental care, and are the basis of medical devices such as artificial pacemakers. In order to use a polymer as a biomaterial in the human body, it must be able to perform its role without causing any harm or safety concerns to the living system. In other words, it must be biocompatible. Any biopolymer or biopolymer device will undergo lengths of testing before it is approved for use in a medical application. Whether a medical device will be biocompatible or not depends on a number of factors. Tests are run based on these factors and could be either in vitro or animal-based. In Europe, testing carried out must comply with something called the ISO standard 10993, a set of standards that are followed to measure the biocompatibility of medical devices before any clinical trials can be carried out. The standard consists of 20 parts and takes 3 general categories of human contact into account: surface devices, external communicating devices, and implant devices. Here are some further details on these categories, along with some medical examples. We have previously mentioned the polyethylene polymer. This polymer is produced via the polymerization of the ethene molecule, which in turn changes to ethane as the polymer is formed. Polyethylene can be produced via different types of chain growth polymerization reactions, such as anionic or cationic addition polymerization and radical polymerization. Each method will lead to a different type of polyethylene product. Polyethylene can be split into many types or categories, but the two main ones are low-density polyethylene and high-density polyethylene. The type of polyethylene product produced will depend on its structure, its molecular weight, and the method of chain growth polymerization used to make it. The two types have very different properties. High-density polyethylene is a linear molecule which usually has a molecular weight of up to around 500,000, although this can be increased to around 6 million in order to produce very strong fibres. It is produced at a low pressure, often using Ziegler-Natta catalysts. The linear structure of the molecule allows molecules to pack very closely together with strong intermolecular forces present, making it a rigid structure. It is very strong and has high tensile strength. Low-density polyethylene, on the other hand, is a much weaker, more flexible material. This is due to its different structural properties compared to high-density polyethylene, which arises from it being formed via free radical polymerization. Free radical polymerization gives rise to the possibility of a side reaction, which can lead to branching. When branching occurs, a new chain begins to grow out of the middle of the original polymer chain. When many short branches are present, we have a low-density polyethylene. This branching prevents its molecules packing closely together like they can in high-density polyethylene, and so we end up with a low-density material with weaker intermolecular forces and lower tensile strength. Due to its great strength and resistance to wear, high-density polyethylene is often the biomaterial of choice used in hip or knee replacement surgery, spinal implants, and cardiovascular stents. In joint replacement surgery, the new artificial joint will have high-density polyethylene lining its bearing surfaces. A joint replacement needs to last and function for a long time, and so needs to be produced from long-term biomaterials. However, this is not always the case. Sometimes, the ability of a biopolymer to slowly degrade and break down without surgical removal has its advantages. Examples include dissolvable stitches, drug delivery systems, medical scaffolding, and simply avoiding the need to intervene surgically a second time to remove the material. These short-term biomaterials are known as biodegradable polymers. Examples include polyesters, polyamides, polyanhydrides, and many more. The use of biomaterials in medicine is expanding and changing every day. More and more problems are being tackled with the use of polymer biomaterials, and new ways to apply them are always being explored. Here are just a few of the possibilities being discovered and employed already with biopolymers.